everybody, I'm Heather Knox, Chief Executive here in NHS Lanarkshire, and speaking to you today from University Hospital Wishaw, where I have been joined today by the Chief Executive and Director General of the NHS in Scotland, Caroline Lamb, who's come on a visit here to Wishaw, and she's also going to meet colleagues from our North Partnership team this afternoon. This morning she'll be going around some of the ward areas and also talking to staff at the front door area, and we've just spent a bit of time with the management team talking through some of the challenges that the site has experienced over the last couple of years. So that's been really helpful, and also talking about some of the initiatives we think the NHS could benefit from, particularly thinking about some national workforce initiatives which Caroline has said she'd be keen to help us with, so that's been a really productive conversation. I wanted just to also mention the numbers at the moment within NHS Lanarkshire. So the COVID numbers, new cases yesterday, 1028 reported, and that's been fairly stable. We do think the new cases coming through across Scotland are now beginning to come down, so we're hopeful that our inpatient numbers will follow in a couple of weeks. We were at 307 inpatients across the acute sites yesterday, so again quite a high number, not quite as high as the number we saw last February, which was 337, but not far off it, and I think the hospitals have done really well to cope with that additional demand at a time when we're still trying to do a lot of other things as well and trying to recover some of our elective performance. So thank you everybody, because I know that's been a really difficult past 6 weeks or so. Still got outbreaks within our care homes as well. About half of our care homes across Lanarkshire have still got care home outbreaks, so that's making it quite difficult to discharge patients, but we're doing a lot of work to do risk assessments on a patient by patient basis to see who we can get out and try and get some flow moving within the acute sites. Just wanted to end by reminding everybody that tomorrow is the 2nd of April, so obviously that sees the start of Ramadan, which is a month for people who are observing Ramadan, so I know you'll all want to respect that for staff and patients. Thank you for listening.